Okay, I am doing my project on a comprostate, or known as Campral. It is a therapy class alcohol abuse therapy. Drug indication is for the maintenance of alcohol abstinence. So the first thing that you need to do with this drug is do an assessment on your patient and assess the signs of alcohol withdrawal at the start. So the action of this drug is to interact with and restore the balance to the CNS GABA neurotransmitter systems. So essentially that means that it slows down brain activity by blocking out chemical messages into the central nervous system. So some pharmacokinetics about this drug is absorption. It's about 11% absorbed following oral administration. It is not metabolized. It is excreted mainly unchanged in the urine. Half-life of this drug is about 20 to 33 hours. So what that means is it takes that amount of time for the amount of drugs, the active substance in the body is reduced by half. And it also depends on how each person's body processes the medication. The plasma concentration of this drug by mouth peaks at 3 to 8 hours. So the contraindications of this drug, first is hypersensitivity. So just kind of watch for that. And then also severe renal impairment. So one good test to do before administering this medication is to get a GFR, which measures how well the kidney removes waste toxins and extra fluid. The GFR includes age, sex, and creatinine level. Some nursing considerations for this drug is moderate renal impairment. So if they do have that, you would lower the dose. From what I've read, it's like half a dose. So they usually get 333 milligrams twice a day. You would half that, and they would get 333 milligrams once a day. You need to watch if they have a history of depression or suicide attempts. And then obviously, if they are pregnant, you would only use this if the potential material benefit justifies the potential fetal risk. Lactation, same kind of thing. If you use it while breastfeeding, only if the potential material benefit justifies the potential risk to the infant. Pediatric wise, safety and effectiveness is not established in children. Some adverse reactions of this drug, cardiovascular wise, palpitations, peripheral edema, syncope, and vasodilation. You could also see a rash. ENT wise, abnormal vision, pharyngitis, and rhinitis. Gastrointestinally, abdomen pain, anorexia, constipation, diarrhea, flatulence, nausea, taste perversion, and vomiting. Gastrourinally, it can lower libido and cause erectile dysfunction. Metabolically, it can increase appetite and weight gain. Musculoskeletally, arthralgia, which is joint pain, myalgia, and back pain. Neuro-wise, abnormal thinking, it can cause some anxiety, depression, drowsiness, headaches, and possibly some tremors. Respiratory-wise, it can cause a cough and dyspnea. Some lab test considerations, this may cause anemia, lymphocytosis, thrombocytopenia, hyperglycemia, abnormal liver function test, high AST, high ALT, which have to do with liver, hyperuricemia, and bilirubinemia. So treatment-wise, this drug, you need to start it as soon as possible after the period of alcohol withdrawal, when the patient achieves abstinence. If they do relapse, then you do want your patient to continue this drug. There's no indications of with or without food. And then as far as patient teaching and education, mainly to continue the medication even if they do relapse. It can cause dizziness and change in vision. So you want them to kind of avoid driving until they figure out their response to the medication. And then, yeah, that's it. Thank you.